So we are discussing series of interview questions. So here comes to third question. Your third question is differentiate manual checks, programmed checks, computerized checks. Ultimately, CDM role is to validate the data. So this will be done by performing the data review. So data review will be done in order to identify the discrepant data, invalid results. So this data review will be done manually or it can be done programmatically. If it is manually, you will get manual listings. You can look into it and make the judgment. So manual checks involve visual check of the CRF with a manual review of the data for the illogical data, inconsistent data. So here is a good example. That means manually we check the data and identify the illogical and inconsistent data. Here is a good example. So usually whenever a patient is suffering from the adverse event during the clinical trial, they will be treated with the medication. It is called concomitant medication. So here you can see concomitant medication record is there for the adverse event. We have record for the concomitant medication, but so-and-so adverse event. But adverse event is not recorded for the patient. Medication for the adverse event is there, but adverse event is missing for the patient. For that, we need to check the data manually. So this kind of discrepancies require manual judgment. So it is also can be done programmatically. So programmed checks are done through the edit checks. These are the programs written to identify the discrepancies in the data. So these checks can be run during the data entry or at the end of the data entry, means after completion of data entry. So at the defined intervals, we run the edit checks. So edit checks are run at the time that you're entering data, or it can be run in batches at the defined intervals after completion of data entry. Initially, edit check program tested with the dummy data. Initially, these are the checks which are tested with the dummy data in test mode. Generally, the dummy data containing discrepancies. So we test the edit checks with the dummy data. If there are discrepancies in the data, system will highlight them, identify them. Then we'll move them to production environment, live mode. Here is a good example for the programmed checks. So let us see. The protocol requirement is a diastolic BP should not be greater than systolic BP. Example, you see diastolic BP should not be greater than systolic BP. So this is your requirement. So this is your specification. Usually based on specification only, we write the edit check. So for this specification, we create the edit check stating diastolic BP greater than systolic BP. If this condition true, then system will identify the discrepancy. So this is good example. Anyway, we have again here cross-form checks also there. Cross-form checks within the form checks. That means a comparison of variables within the CRF across the CRF. So this is commonly asked question. The difference between manual checks, programmed checks. So you can differentiate by explaining what is manual check, what is programmed check. If possible, you can give the example also. If you have any questions, you can ask in the comment section. Thank you for watching this video. See you in the next video.